So we were awarded the Total Ankle Replacement Revision Arthroplasty grant. And the goal of that project was really to understand the differences between patients who had a primary total ankle and those that had a revision surgery. And so what we've been doing over the last year or so is really collecting that information, looking at the different patients and following them out for a year to see whether or not they are different before surgery, but then also what do they look like by 1 year post-op? Are they the same or are they different? And so what we have found so far, which we're still sort of in the analysis phase, is that these patients preoperatively do look very different because those patients that are having a revision are in a lot of pain. The implants usually failed. But the few patients that we've brought back at a year are very similar. So it may be that those patients that are having a revision surgery are actually doing about as well as those that have a primary replacement by about a year out. The OREF grant that we received has been phenomenal for me. It's allowed me the opportunity to collect data on patients I normally wouldn't have been able to. And it's provided me some information for the NIH grant that I'm writing. So it has given me some pilot data that I can really use to prove that there is a need to go in and look at ways that we can alter post-operative course in these patients and change the, what is done with them to improve their outcomes. I think the most exciting time for me has been working with a medical student who wasn't even sure he really wanted to do orthopedic surgery, but he came into the lab for his research year, for the full year, and he was working on the project that we are grant funded through the OREF for. And he really had the opportunity to interact with the patients, to see what it was like before and after surgery, to understand the work that we're doing. But it was wonderful to see in his eyes sort of that connection that he made between what somebody in research can really do and how it can impact patient care. And understanding that the work that we do isn't in isolation and it isn't outside of what is happening with regards to their clinical care, but that we're all part of a bigger team.